You mentioned different modalities you have experience with. Do you have obviously we have a bias. We're MRI guys,
Yes.
but do you have a bias
favorite.
too? Do you have a preference? Which modality?
I think in terms of safety, I think both techniques, echo and MRI, are extremely safe. What echo brings to the table is flexibility. So it's a small machine. You can bring it anywhere in the emergency room,
Echo
in the
means
ICU.
sonography, yeah.
Yeah.
That's right. So ultrasonography is capable of answering basic questions. If there's fluid around the heart, the cardiac function, and also quite precisely assess the valvular function.
Right.
Because it's got such a great temporal resolution, the ability to look at things in real time, it's really quite an advantage to use as a first-line tool. We use other things also, like X-rays and EKGs and blood tests. MRI comes in as a more second-line imaging, usually to answer questions that echo can't. The advantage of MRI, as you know, it's been around for decades and discovered initially in the 40s and popularized by Bloch and Purcell as a modality to analyze tissue. And we make pretty pictures out of it, but never forget that MRI characterizes tissue.
Right.
We can see the difference between fat, muscle, fluid, tumor, and that's really what MRI brings to the table: the ability to categorize tissue.
Nice. Ultra high definition right there. Right?
Ultra high definition,
Versus
better spatial resolution
Right.
than echo. Echo has about a 2 millimeter spatial resolution. MRI between 1 and 2, which is still not as good as CT, which is sub-millimeter spatial resolution. So CT brings in that ability to see really, really small things. But CT, no one's perfect. Nothing's perfect. CT doesn't have the temporal resolution. So in terms of doing cines, it's a little bulkier than certainly
The
MRI
right.
and most certainly echo. Echo has a temporal resolution of 30 to 60 frames per second. MRI, let's say 25 to 30 frames per second. And CT, we'll say roughly about 15 frames per second. It still does pretty good cine work, but it doesn't have that temporal resolution.
Yeah.
So both MRI and CT are second-line agents. The advantage CT has over MRI is that it's a faster test to do.
Oh, right.
Patients tolerate it better, I find, also. There's less claustrophobia and there's less...
Because it's faster.
It's faster. So the patient doesn't have to stay in the scanner longer. But again, MR is able to look at function in a 3D fashion. Is able to characterize tissue, to see, and with the use of gadolinium enhancement, the official approved use is angiography, but the unofficial or off-label use uses the enhancement of the heart muscle and of cardiac tissues to judge on the perfusion or lack of perfusion of these tissues, and helps in categorizing these.
Right.
The added value is a phenomenon called late gadolinium. Well, there's early gadolinium enhancement, which we've used for decades for tumors, but there's late gadolinium enhancement.
So it's like delayed imaging?
Delayed images, yeah. And those have been around sort of since the mid-1990s, came into prime time really in Y2K around, and have been used widely, off-label for 20 years, basically.
Right.
I think this is about to change. I think there are some studies that have come up that have
solidified the use.
Yeah, solidified the use.
Nice.
Looking at perfusion and ischemia in comparison to nuclear myocardial perfusion imaging with nuclear methods, and found quite advantageous using contrast. And I think this should be revised.